If you have spinal stenosis that's causing leg pain, trouble walking, or low back pain, this simple position could give you relief in the next 60 seconds, and we're going to do it together right now. Hi, I'm Dr. Zielonka, a neurofunctional chiropractor in Ottawa, Ontario, and this move is called the 90-90 relief position. So you're going to lie on your back, you're going to rest your legs up on a chair so your hips and knees are both bent at 90-degree angles. In this particular case, I'm using a weightlifting bench out of our clinic. But any chair, any sofa, anything that's going to allow you to do that 90-90. You're going to take a slow breath in and you're going to let it out. I'm turned towards the camera right now, but ideally you would just rest comfortably and look straight on. And you're going to take that slow breath in and you're going to let your spine actually sink into the floor. What we're looking to do is we actually want you to get that pressure off the spine. So the position unloads your spine. It actually relieves pressure on the nerves, and that's why so many people with spinal stenosis feel better almost instantly. So do you feel that? You know, lie down, let the spine sink into the floor, 90-90, take a nice deep breath in. And you're going to do that for a good 1 to 2 minutes. I want you to stay right here with me while I guide you through it. Now, keep watching the video because in a moment I'll show you 2 more easy exercises that you can do at home to reduce pain, create more space in that spine, and to make standing or walking feel better and get you back to doing the things you want to do again. So why does the 90-90 relief position work so well for lumbar spinal stenosis? It's because it places the lower back in a gentle flexion position. So flexion or rounding of the lumbar spine, it would be the same as if you're standing, it's bending forward to touch your toes, that's the flexion movement. It helps open up the spinal canal. That relieves pressure on the nerves that cause pain, numbness, or tingling in the legs when you suffer from spinal stenosis. It also unloads the joints, it relaxes tight spinal muscles, and it gives your nervous system a chance to reset. You can do this relief position 2 to 3 times per day or as needed when your symptoms flare up. Just find something to elevate the legs like a chair or a couch and lie on the floor. Your thighs should form a 90-degree angle to your torso, and your shins should also form an approximate 90-degree angle to the thighs as well. Hence the name 90-90. So stay in this position for a good 3 to 5 minutes if you can for maximum effect. When you're ready to get up, you gently roll to one side, you use your arms to push yourself up, and you come up slowly. Now you should begin to feel relief in the back and the legs, maybe even lighter, looser, or more comfortable when you stand. And if you do, please leave a comment and let me know how you felt. Now, if you like that one, we're going to build on the relief you just created with 2 more exercises specifically designed for spinal stenosis. The next one is called the prone flexion roll. So you can see this is where you're going to lie on your stomach over a gym ball. Okay? The gym ball is going to gently round the spine. It's going to open up the canal even further, and it's going to give your nerves even more room to breathe. Okay? So the next relief move, as I said, is called the prone flexion roll. For this one, we're going to get a medium to large size gym ball, depending on your size, of course, about 55 to 65 centimeters for most people in diameter, depending on your height. But don't worry, if you don't have a ball, I'll show you a variation in just a moment that gives you the same benefit without needing any equipment whatsoever. So what you're going to do is you're simply going to kneel on the floor. I'm already doing that. You're going to drape your body over the gym ball, okay? And when you're doing this, you're going to let your stomach and chest lie on top of the gym ball. Okay? You can let the arms dangle. Again, always a little different when I'm demonstrating for you because I'm speaking directly into the camera for you. You're not going to be looking straight ahead. You're just going to drape over the gym ball. The lower back should naturally just round into a gentle flex position. And you're going to take a deep breath, and you're just going to let the body sink into the ball. Okay? And in doing so, we're getting the exact same effect again, where we're introducing some flexion into the lumbar spine. We're just doing it at a slightly different angle in a slightly different way. So as I said, what this does is it creates lumbar flexion, just like the 90-90 position, but from a different angle. So the flexion helps open up the spinal canal. It relieves pressure on the nerves that run down into the legs. It also helps relax tight spinal muscles. It decompresses the joints. It reduces the heavy or burning sensation you might feel when standing or walking for too long if you suffer from stenosis. You can stay in the position for 2 to 3 minutes, and just like the first move, you can use it 2 to 3 times per day as needed for relief. When you're ready to come out of it, again, place your hands on the floor or the ball. You're going to push yourself up gently and come out of the position slowly. Okay? A little side story, when I was at the Sports Science Center here in Ottawa, one of our very first patients, well-known Olympic gold medal sprinter in Canada, very well known. I won't give you his name. First time we put him on a gym ball, he fell off the gym ball. So please be careful when you do these things that can happen even to the best of athletes. Now you may notice that your back feels looser, or your legs feel less tight or less irritated. That's the power of flexion-based relief for spinal stenosis. Now, if you don't have a gym ball, here's a variation you can do anywhere, even at your kitchen table or your office chair. It's called the seated flexion fold, and it mimics the same spinal rounding position as the prone flexion roll. You're going to sit on a sturdy chair. You're going to spread your knees slightly apart. You're going to slowly lean forward, and as you lean forward, you're going to let your chest rest on the thighs. You're going to let your arms dangle. You let your head and neck relax. Again, I would normally do that, but I'm speaking to the camera. And then you're going to take a slow breath and hold this position again for 1 to 2 minutes. You should feel that same gentle decompression going on in the lower back and possibly relief even in the legs. Just like the other moves, if it makes your pain feel lighter, then your legs can feel looser. You may find that walking may be more comfortable again. That's a good sign that your body responds well to these positions of flexion. And people who suffer with spinal stenosis, they will typically feel much better in flexion because it opens up that spinal canal and takes the pressure off the nerve. So now that the spine is more relaxed and your nerves have more room, we can add a pelvic movement that mobilizes the lower back and relieves back and leg pain as well. It's called the posterior pelvic tilt. So one of the most important exercises that you can do for long-term spinal relief, especially if you've been dealing with recurring symptoms. So the seated posterior pelvic tilt is a powerful way to get lower back relief and decompress the nerves that travel down into the legs without ever leaving your chair. This movement gently induces lumbar flexion again, which opens up space in the spinal canal. I don't want to sound like a broken record, but we need to get this through to you. That's why there are different exercises for different back conditions. Some back conditions are the exact opposite movement as others. So with spinal stenosis, we want to be introducing flexion. So when we do this, when we open up that space in the spinal canal, we reduce the pressure that causes pain. It'll actually decrease the tightness, the tingling when you stand or when you walk. Here's how you do it. You're going to sit again in that sturdy chair, and with your feet flat on the floor, your hands are going to be resting on the thighs or on the hips. And what you're going to do is you're just going to gently tilt your pelvis backwards. Okay, the best way for you to understand what we're doing, it's as if you're tucking your tailbone underneath you. And as you do this, you're going to feel that your lower back is actually going to flatten. If you're doing this while you're lying on your back, you'll actually feel the lower back flatten and make more contact with the floor. Your spine will actually round into more of that flex position again. You're going to hold the position for 5 seconds. You're going to slowly return to neutral seated position. You're going to repeat this 10 to 12 times using a smooth, controlled rhythm. So pelvis backwards, tucking underneath. Actually feel that the back is coming more into contact almost with the chair if you're against the chair, or if you're the floor, you'd actually feel it more on the floor. You can do this exercise 2 to 3 times per day, or whenever you need quick relief from lumbar tightness or leg symptoms or anything dealing with spinal stenosis. So overall, you should feel a subtle rounding in the lower back, a release of pressure in the spine, possibly reduction in pain, numbness or tension in the hips and the legs. This is not a big movement, and that's the point. It's small, controlled, and safe for most people with spinal stenosis. And over time, it helps improve spinal mobility, nerve space, and comfort when sitting, standing, or walking. So now you've got a solid follow-along exercise sequence for quickly relieving lumbar spinal stenosis pain safely, naturally, and without even leaving your home. These 3 movements work together to decompress the spine, relieve nerve pressure, and make standing or walking feel easier. If you found the video helpful, please go ahead and like it and share it with someone you care about who's dealing with spinal stenosis pain. Now, these simple targeted movements might be the exact thing that they need to feel better, even if it's just for a few minutes. And if you're ready for a full plan, I'll walk you through the complete 7-step non-surgical treatment plan for lumbar spinal stenosis, including the exact process I use with my patients in my clinic. Click here to watch that video next. I'll see you there.